Hi, I'm Terri Berry, and this is video 2 for my age management case study. For this video, I will be covering my 8-week corrective treatment plan. My model Pam is 63 years old, postmenopausal, and presents with intrinsic and extrinsic aging markers, including dermal thinning, collagen depletion, laxity along the mandibular contour, cellular lentigines, and perioral rhytides resulting from previous smoking. The primary goals for this case study will be to restore cutaneous integrity by stimulating fibroblast activity, enhancing mitochondrial ATP synthesis, improving dermal hydration, and reorganizing collagen and elastin fibers to correct tissue laxity and photo damage. I will begin with enzyme mass resurfacing treatments to initiate epidermal renewal and prepare the stratum corneum for mandelic acid integration. Neogenesis products containing S2RM technology will be introduced to deliver biosignaling molecules that upregulate fibroblast communication and initiate dermal remodeling. Red LED light therapy at wavelengths of 630 to 660 nanometers will be used to increase ATP production and stimulate collagen and elastin synthesis. Once initial hydration levels and the skin barrier has improved, I will introduce a 20% mandelic acid peel at a pH of 3 to achieve uniform exfoliation and tyranase modulation. Mandelic acid's large molecular weight will ensure slower epidermal diffusion, minimizing irritation while promoting pigment normalization. I will also use microcurrent therapy combined with washa to stimulate facial musculature and enhance oxygenation. This integrated approach will progressively restore dermal density, improve elasticity, and refine epidermal clarity by combining mandelic acid exfoliation, Neogenesis S2RM technology, which has molecular signaling, red LED photobiomodulation, and microcurrent biostimulation to rejuvenate the skin at a cellular level.